Hello everyone. We have started gynecological case series. This is 24th case and I'm going to present a case on cervical cancer. Cervical cancer is a malignant tumor present at the cervix part of the female reproductive system. Let's understand this condition in detail through a case. A 28-year-old woman was referred to the colposcopy clinic as she was having complaints of intermenstrual and postcoital bleeding. Her pregnancy status is she already has a one child and hoping to have one more. In objective data, a microscopic examination was done in which a visible lesion was present. Then colposcopy features showed malignancy. Then subsequent biopsy was done which showed invasive squamous carcinoma of the cervix. The mass was found to be 3 cm in size and there was no palpable extension into the uterus, vagina or parametrial tissues. So colposcopy is the instrument which is used to examine the cervix, vagina and vulva region. It has binocular microscope and light source. The cystoscopy and proctoscopy were both normal, and cystoscopy it is used to examine the bladder and urethra, and proctoscopy it is used to examine the anus and rectum. All lab reports are normal as they are not related to the condition. Renal tract ultrasound report also showed normal size kidneys. Both ureters are of normal caliber with no evidence of obstruction. Let me explain about the condition and the staging of the cervical cancer. The staging is performed clinically at the examination under anesthetic as described. Stage 1, Stage 2 and Stage 3, 4 are shown in these images. Stage 1, carcinoma confined to the cervix. In these subtypes are 1A and 1B. 1A is microscopic carcinoma and 1B is macroscopic carcinoma. 1A1 stromal invasion less than 3 mm depth and 7 mm wide. 1A2 in stromal invasion up to 5 mm diameter and less than 7 mm wide. 1B macroscopic carcinoma. 1B1 up to 4 cm lesion and 1B2 greater than 4 cm lesion as shown in the images. In stage 2 carcinoma extending beyond the cervix to the upper two-thirds of the vagina or parametrium. In stage 3, carcinoma extending to the lower third of the vagina or the pelvic side wall, as shown in the images. In stage 4, carcinoma involves the bladder, rectum, or beyond the pelvis. Based on the staging, the treatment is decided. Let me summarize the stages of cancer. Stage 1, carcinoma confined to the cervix. Subtype is 1A, which is microscopic carcinoma. 1A1, stromal invasion less than 3 mm depth and 7 mm wide. 1A2, stromal invasion up to the 5 mm diameter and less than 7 mm wide. 1B, macroscopic carcinoma. 1B1, up to 4 cm lesion. 1B2, greater than 4 cm lesion. Stage 2, carcinoma extending beyond the cervix to the upper two-thirds of the vagina or parametrium. Stage 3, carcinoma extending to the lower third of the vagina or the pelvic side wall. Stage 4, carcinoma involves the bladder, rectum or beyond the pelvis. Let me brief the cervical cancer symptoms. The common symptom in cervical cancer is intermenstrual bleeding and pain during intercourse. Others are discomfort while urinating, constant fatigue, unexplained weight loss, pelvic pain, vaginal discharge, and back pain. The most common cervical cancers are caused by human papillomavirus, which is commonly passed through sexual contact, and other risk factors for the cervical cancer include tobacco consumption, immunocompromised patients, long-term use of oral contraceptives. So, let us discuss the possible treatment options for this case. Cervical cancer may be treated surgically or by the radiotherapy based on the staging. Radical hysterectomy. Up to the stage 1B, women may be treated with radical hysterectomy. This involves removal of the uterus, cervix, pelvicle, and lymph nodes and vagina and parametrial tissue as well as the upper third of the vagina, as shown in this image. The complications are bleeding, infection, ureteric damage, and blood vessel injury. Post-operative complications include infection of the chest, wound, or urinary tract. The advantage of this treatment is that it preserves ovarian function, important for well-being and prevention of the osteoporosis. It also avoids the complication of radiotherapy. Alternate surgery can be done is trachelectomy. This involves removal of the cervix, lymph node, and parametrial tissues with the conservation of ovaries and uterine body with the insertion of suture at the base of the uterus, as shown in the image. It is used selectively for women with early stage disease who wish to preserve their fertility. Radiotherapy. Disease beyond stage 1 and postmenopausal women should be treated with radiotherapy, which is effective but also associated with long-term effects of bowel stenosis, cystitis, and vaginal stenosis. It also generally renders women menopausal due to the radiation to the ovaries. This finishes the case. If you learned something from our video, please like, subscribe, and share. Thank you.